And I am not even sure where we are these days with healthcare, because they talk about one care.
Yes.
And I haven't gotten a handle on that one in my mind anyway.
So I think we have to just accept, people don't like the word socialism. It's very loaded. Some people think it's good. Some people think it's bad.
Right.
But Vermont, we have to just be, let's call a spade a spade. Vermont has a socialized economy. Our largest employer is the state government.
Right.
And then we have healthcare and education. Healthcare has many monopolies. The biggest one is UVM, that's state run.
Right.
And then Vermont Health Connect, which is, again, has a monopoly of Blue Cross Blue Shield of Vermont in terms of the insurance. And we know that BCBS has a very cozy relationship with the legislature.
For sure.
Right? And then we have education, which is, again, public school and that. So if you see, there's no room for industry, private enterprise, businesses. So we do have a socialized economy. And when you have a socialized economy, freedom at all levels is automatically curtailed. That's the whole point of having central planned, as opposed to letting people be free. So in healthcare, we know in 2011, then Governor Shumlin tried to enact single payer, but it failed.
Right.
Why did it fail?
Not enough people to pay the bill, in my mind anyway.
Right, exactly. So what happened is that they did some honest number crunching, and they saw that every year, the cost growth of the model exceeded the annual GDP of Vermont. So it broke.
Right.
So,
which they knew going into it.
Yes, of course.
Just saying, because we didn't hear that until it was the absolute last thing they could possibly admit to.
Right. So then, well, Shumlin is gone, but the rest of the Green Mountain Care Board and the rest of the players tried something new. And so this 2.0 version is something known as all-payer model, and that is a healthcare financing model. And their goal is to show cost containment. That means we are able to contain costs. And I think a lot of people, even Republicans, have kind of bought into that and thought, oh, this is a good thing. And they say that's the success of the model. But see, why I talked about socialism and why I talked about a socialized economy is that it always leads to rationing of goods or services, because you're not able to maintain a proper supply and proper demand. When someone is sitting in a room and planning and saying, okay, this goes here, this goes there, you don't have enough knowledge and information to direct things properly. So you'll always have shortage, and it'll always lead to long waiting lines. So that's what generally happens. But in this case, when you are desperately trying to show cost containment, you're saying, no, we're not spending. How do you stop that? How do you stop the cost from going up?
Right.
You say, no services.
Right.
So we have seen, I have statistics to show that there's been a decrease in the use of primary care providers, decrease in the use of specialty physicians, and health quality indicators have worsened. So it's not like everyone's doing well and therefore not using it. And we have a lot of anecdotal evidence of long waiting lines. So people are not getting, Vermonters are not getting the health care they need.
Didn't we used to call that managed care?
Yeah, managed care is another.
But people hated the term managed care. So, but when this was tried years ago, when it was supposed to be a managed care model, people really didn't like it. But now we have one care, which is managed care, and nobody's connecting the dots that one is, in fact, a managed care.
Well, the term was HMO back in the day. Now it's called ACO, Accountable Care Organization. It really is just a revamped version of HMOs. And Dartmouth professors came up with this concept of ACO, and was sanctioned by President Obama under Obamacare, which is how it took off. So yes, the all-payer model is an ACO all-payer model, and it is managed by a private company called One Care Vermont.